I did it. It's recording.
Okay. All right. Great. Continue. All right. So good afternoon. Thank you all for taking time out of your Sunday afternoon to join us on our first seminar called Rewarding Medical Careers Without a Four-Year College Degree. So just briefly, I want to tell you how it all came to be. My good friend Melissa and I were talking and planning some other Zena's House activities. And we were talking about our young people today, and we were finding that as I have been subbing in the high schools, that a number of them are not interested in going to college, but are interested in pursuing a career. So we wanted to put this together to help show our students and young adults that there are definitely some rewarding medical careers out there where it doesn't require a four-year degree. So I meet them all the time at the pharmacy tech, the dental assistant, the medical assistant, the EMT, all awesome jobs. And so I wanted them to talk with us, talk with our young people to explain exactly how do you become one of these medical professionals to help our students. There's lots of schools out there that have this training. So again, knowledge is power. So that is why we're doing this, again, to give our young people options and share opportunities with them. So with that, I am Bernice Bronson, Executive Director and founder of Zena's House. I'm so happy to be here. We are going to have our moderator, which is Miss Jutia Merriweather, to be our moderator. I met Miss Merriweather as a sub at Langston, and I saw that she was a health careers teacher and coordinator. So I'm like, oh my gosh. So we've connected, and it's been great knowing and working with Miss Merriweather. So I'm so glad to have her as our moderator. So how this 1.5 hours is going to go is I'm going to formally introduce Miss Merriweather. Miss Merriweather is going to give an overview of healthcare careers. She's going to briefly introduce our speakers, and then our three speakers will speak for about 30 minutes. We're going to ask some questions, and then at 3 o'clock, we're going to take your questions and answer them at that time. So we ask that everyone, even if you have questions now, go ahead and put it in the chat box, and we will answer them all at 3 o'clock. After that, we will wrap up. I do have a few prizes to give away, and then we will put in the chat box a link for everyone to complete a short evaluation. We always want to know how we do and how we could do better. So please, if you would take a few minutes to complete the evaluation at the end. And our dear friend Melissa and longtime volunteer supporter, volunteer and financial supporter, my good friend Melissa Hagan, Dr. Melissa Hagan. She has a PhD. We actually met 20-something years ago when we were both working on our master's in public health at the University of Pittsburgh. So I'm so glad to have her on here, and she will be going through the slides. Let's see, I think that is it. And now I'd like to formally introduce our moderator, Miss Merriweather. Okay, next slide. Okay, Miss Merriweather, as I told you, I met her. She is an educator at Langston Hughes High School. She has an associate's degree in diagnostic medical stenography from Gordon State College. She received her Bachelor of Science in Healthcare Management from Clayton State. She has a Master's of Art in Public Administration and Management from American Public University. And she received the Career Technical Agricultural Education Certification from Georgia State University. So Ms. Merriweather is all things healthcare. She is here to help our young people get to where they need to be. She is extremely qualified, well diverse, and she also told me there's a pharmacy tech program at Langston. So I'll let her share a little bit more about that. But again, Ms. Merriweather, thank you so much.
Thank you so much for having me. This is an honor and a great privilege to be here and share because I am very passionate about healthcare. I've done it now, it's been about 16 years. So
Mm,
I am very, very passionate. I did start as a pharmacy technician. And
mm.
from there, I have just done different things. So definitely being an educator is something that I definitely enjoy, although we have had a very stressful year this school year. I still definitely enjoy, and I do miss all of my kids. So, um, Langston Hughes High School is where I am. We actually have, under the career technical umbrella, healthcare science. We do have pretty much all the high schools in the county have different programs. Langston Hughes is the only school in Fulton County that has a pharmacy tech program.
Oh,
So we do actually push for our students to complete their certification. So every student has what's called an end of pathway assessment, which is basically how they're considered a completer of the program. So all of our healthcare programs are 3 years. And we have not only the pharmacy technician program at Langston, we also have the medical administration
oh.
program. So our students are eligible to go into doing all kinds of front desk work and secretarial work in healthcare. So if they choose, they definitely have that. So pretty much the other schools, you can have anything from a CNA certification over at Banneker, or they also have physical therapy. We
Mm,
also just have EMT actually. They have, I believe, over at Tri Cities. So there are a lot of various programs all over the county. So we're definitely excited about what we have to offer. We try to push our students through that just because, as Ms. Bronson said, a lot of our students don't know if they want to go to college and incur all of that student loan debt for something that really is out there. So even as a pharmacy tech, our kids can, as juniors or seniors, be certified and go straight to work. So it is a very good program. So I also do what's called Hosa. Hosa is a student organization it is an actual worldwide association for students who are interested in healthcare. And so they actually provide scholarships. We do take trips at Langston for Hosa. We haven't been able to do it this school year. My first year of getting at Langston, we actually went from about 20 scholars in Hosa to almost 80. So the
mm.
first 2 years, we actually jumped our enrollment had tripled over the 4 years I've been there. So this year has been a little bit different because,
Mhm.
of course, we haven't been able to do as much, but we have a lot of conferences our students enjoy learning. We've had the Surgeon General come and speak to our
Mm,
students at the State Leadership Conference downtown. So our kids are there for
nice.
about 3 days. And it's Hosa is great. I love it. I really do. And I enjoy telling my students about it. I hate that a lot of them have been able to experience it this year, how great it really is. But hopefully next year will be great. So I definitely, once again, am thankful for being here. So I appreciate you all giving me these last couple of minutes to Langston with you.
Awesome, awesome. Thank you so much.
Thank
So
you.
now, I forgot to ask for the students, everyone, if you could please put in the chat box, if you are a student, if you're a high school graduate, a parent, or community member, so we can know who our audience is. So without further ado, we are going to start with our panel. And so if we could get next slide, please. Next slide, please.
I'm sorry, Bernice. You took the.
I can't.
Yeah.
I did?
Okay. Is it moving now?
No.
No.
Okay.
Sorry. Let me see.
Waiting for Melissa to control. Okay.
I'm sorry.
All right. Thank you. to the before. Okay, here we go. Miss Merriweather, you can go.
All right.
You can. Thank you.
Thank you. All right, so joining us this afternoon, we have Miss Jewel Frederick, who is a dental assistant. She attended Clara Barton High School in Brooklyn, New York. We also have Miss Alicia Miller, who is a pharmacy technician and received her training through her employer on the job. And then we have Miss Nicole Cross, who is an EMT or emergency medical technician, and also a medical assistant that she received certification through Everest Institute. So the way that this is going to work, ladies, first, thank you. Uh-oh. So the way this is going to work, I will ask one question, and from that one question, each of you will have an opportunity to answer that question and add anything that you feel is pertinent. And then from there, we will move on to the second and third question. Any questions? Awesome.
Yeah.
Okay.
Mm-hmm.
All right, so we can start with Miss Nicole if you are ready. The first question is, what made you choose your career?
Is there feedback? I'm hearing feedback. Are we good now? Okay, can hear you, Nicole, I think. Okay. Okay, Nicole, can you hear us?
Okay, can you hear me?
You may have to put that on the phone on mute. You may have to put that on.
Okay, can you hear me now?
Yes.
Okay, so I am speaking about
still feedback.
I can't hear you.
It's still feedback because did you call or did you, is it on your computer?
Let me try something.
Nicole, I think
Can you hear me now?
Yes.
that's better. Yes.
Yes, much better.
Can you hear me?
Yes.
Yes.
I can't hear you guys.
So I don't think you're muted, Nicole. Are you on two devices? Can you, Nicole, are you on two devices?
She said she couldn't hear us. We can hear her, but she couldn't hear us.
I can't hear you guys.
Oh.
So we can actually, while Miss Cross is working that out, Miss Bronson, we can go ahead. Miss Jewel, or do you want to go ahead and answer that first question about what made you choose your career?
Yes, I can. Hello, thanks for having me. I'm Jewel Frederick. I'm a expanded function dental assistant. I've been in the field for over 23 years. I started in high school in New York, in Brooklyn. It was a, I'm also having that feedback from my, hello?
It may be from Nicole. I've muted myself. Nicole, you may have to mute yourself for now. Okay, let's try that.
Okay. I went to school at Clara Barton High School in Brooklyn, New York. It's a school for health professions. For the last 2 years, the 10th, 11th, and 12th grade, I did dental assistant. My 12th year, I worked 2 weeks in school and went to my extern for 2 weeks for the whole entire school year. Dental assistant has been great. I love it. I love the field. I love helping patients, making people smile. It's been a great career so far. Like I said, I've been in there for 23 years to be exact. So it's been a while. Yes.
Awesome. Okay. Thank you so much, Miss Jewel. All right. So is it Alicia? Okay. All right. So if you will, tell us about what made you choose your career. Uh-oh, we can't hear you, Miss Alicia.
Okay.
Can you hear me now?
Yes.
Okay. Thank you all for having me. I would say I can probably attest to like the students that are still in high school now. I was one of the people that didn't know exactly what I was going to do when I left college. I didn't want to do a 4-year program, but I knew I wanted to help people and I knew I wanted to be in the medical field. So I came across the job just applying and they gave me the opportunity. So that's kind of how that went.
And you've just been in it ever since, huh? All right, awesome. So Nicole, did we have your stuff together yet?
Yes, can you hear me?
Yes, great.
Yes.
Perfect. All right, so if you will, please tell us what made you choose your career.
Actually, what happened was fresh out of high school, didn't know where I was going to go, what I was going to do. And I was a young mother. I had my child at 17. So I knew that I wanted to be in the medical field and I wanted to be a nurse. But at the time, the waiting list was so long. It was like 2 to 3 years long. And I don't know what. At the time, I had a child. Medical assisting came out back in 1994. And so I said, well, I'm going to try that because that's, I attended school. It was a year program. And I just hit the ground running after that. It's a remarkable career. I actually bought my house off of medical assisted money. It definitely, I wanted to go in another direction again with nursing, but it didn't happen that way. One thing about medical assisting that I did like the most is that you have a lot of different choices in the field. If you don't want to do like drawing blood or blood just doesn't excite you and you don't want to around that type of thing, you can also do a lot of paperwork, a lot of administrative stuff. Can you hear me?
Yes.
Can you hear me? Okay. And so you have different realms of positions that you can choose from. You can be an administrative, you can do the administrative paperwork, you can do the insurance and billing, you can do the back office, in which you can draw blood and give injections and work side by side with the physician. You can do referrals where people are coming in and they have to go to another specialty. So you have a broad variety in medical assisting. And what I did was I challenged myself by learning every aspect of the job, front and back office, because when someone is out, you can cover for them and you are more wanted or needed in the field when you can cover every aspect of the office. That's your referrals. That's your calling in prescriptions and doing your back office and your front office and doing, just learning every aspect of the office was a plus. And you can put that on your resume and you can sell yourself and get more money. And so I did that for almost 20 years as a medical assistant, and it paid really well. And I work with different specialties. That's another plus. You don't have to just be with a cardiologist who works with hearts. You can do respiratory, you can do dermatology, you can do family practice, and you can just get, a great variety of physicians and get under their belt and learn a lot. You can take out sutures and you can clean wounds and you process labs. And it's just, to me, it's an exciting field. And that's what prompted me to go on because I wanted something more challenging, because I had pretty much could run an office in medical assisting. And so I said, what else is more challenging? And that's when I went into emergency medical services and became an EMT. And that was more on the 911 side, where you're actually on the truck and you're driving around and you're saving lives. And that's for people who have a strong stomach, and that's for somebody that wants that excitement. Now, every day is not exciting, but majority of the time you're meeting great people, you're working side by side with the police officers and the fire department, and you're just learning so much as a emergency medical tech. And so I want the students to really think about, if they don't want to go to a 4-year college, that's fine. Go find something to do, whether it's dental, whether it's pharmacy, whether it's emergency medical tech or medical assisting. You should do something and just, find your niche. My niche was medical, wanted to do medical college. And so now I'm currently I am an EMT now, but I just finished school again for paramedic. So again, don't just sit by the wayside. Don't take off a year. Get right into it. These programs are only for a year, and then you're certified and you're there.
Awesome. Thank you so much. All right, so we're going to ask the second question of you ladies. The second one is, if you will, please do us a favor and describe your training. What was your training like? What did you have to go through for that training? So Miss Jewel, we can start with you again.
Okay. When I was in high school, the training was 2 years. But now, usually the dental assistant program can run anywhere from 8 months to a year and a half, I think. The different schools have different time periods, but usually at UEI, I also was an instructor there with Miss Cross. Hi, Cross. We instructed together. So that school is an 8-month program, and you can become a dental assistant in 8 months. And that's UEI, United Education Institute. And that's in Murrow, Georgia.
So Miss Alicia, if you'll answer that question about your training as well.
Well, I work in retail pharmacy. So pretty much all of our training happens at the store. It's a lot of computer-based training. And then initially they send you off to a slower store where you can get like more hands-on training and things like that. But a lot of the training is computer-based and self-taught too. Like, as much information as you can learn, do that. The internet has everything. So I pretty much just been doing on-the-job training there.
All right, and then Miss Nicole will talk about the training for your careers.
My training is normally it's from 9 months to a year. It all depends on if you want to go and get your associates for medical assisting. And what I like best about it was terminology. You had to learn terminology, your anatomy and physiology of the body, and billing. And so it's not just sitting there learning, but also on the job learning when you how to process labs. So it's a very exciting training for you.
Awesome. Thank you.
Can you hear me?
Yes, we hear you.
Yeah.
All right, thank you. So let's see if we can get to our last question. That last question is asking you all to describe what you actually do on a typical day. I know most of our days are different in healthcare, but if you all will just give us what a normal day is like for you all. So Miss Alicia, we'll start with you if you're okay with that.
Yes, perfect. Okay, so day to day, I would say it is pretty exciting. You're doing a lot of interacting with people. So if you love people, it's a really great job. You get to meet so many new people. You're answering calls. People are calling in prescriptions. You're counting prescriptions, counting medications. You're dealing with insurance claims. And since it's retail, you have to deal with like a lot of orders. You get a lot of prescription orders in, and that's pretty much it. It's just like, I don't know. It's a lot going on though, and it's super fun, but it's definitely people-based. So like I said, if you love people, it's a really good job for you because you're in front of people all the time. You're talking to doctors, talking to nurses. So yeah.
Thank you. And then Miss Jewel, what about your day-to-day?
Oh, my day starts pretty early. I usually see our first patients by 7:30 in the morning. So usually I get up around 5:30. But our day basically is we see patients every day. A lot of the time we want to change their smile. A lot of the time they could be in pain, they could be hurting, and we have to help them, or they just want a brighter, prettier smile, or just want some bleaching. But it's a very exciting and rewarding. I have to say my job is extremely rewarding. I've seen people cry because they didn't have enough money to fix their teeth, and they finally saved up enough money and they did it, and they want to hug you when they're done, you know. So it's a very rewarding career being in the dental field. And you know, everybody likes to smile and likes a beautiful smile.
That is true. All right, and then Miss Nicole, if you will, tell us what a typical day-to-day or typical day is for you.
Okay, since I'm doing 2 different programs, I'll make it short and sweet as possible. So as a medical assistant, you're coming in and you're checking in your patient, and you're bringing your patient back, and you're finding out what's wrong with the patient, and you're doing vitals, that's your blood pressure, pulse, respirations, and temperatures. And then you're finding out why they're coming in, and then you relay that information to the physician. The physician then comes in and gives and pretty much treats them. And if the physician orders something for them to get, like an injection, tells the medical assistant is really like the right hand to the physician and gets the job done for the physician. Now, as an EMT, what we do is we come in and we check off our truck, and we make sure that we have lives of our patients. Have 2 different trucks, basic truck, and where you get more evasive, people are having heart attacks or things of that nature. And we get our calls from dispatch, and the dispatch will tell us where to go. And a lot of times people ask me, do you just turn on the lights just so you don't have to sit
in traffic
at the lights? Or, you know, right, you don't want to sit in traffic. The answer to get a huge fine if we turn on our lights and sirens and it's not an emergency. So that's not true. So don't think that you're just going to get there and turn on lights and sirens and shoot through all the traffic. It doesn't work like that. But once we get the call, we are dispatched to, we find out what's wrong with the patient, and pretty much we try to fix them long enough to get them, but try to find out what's wrong in the event that, you know, we need to save their life to a certain extent, if, you know, to get them to the hospital so that they can have more care from the physicians at the hospital.
All right, awesome. I definitely thank you, ladies, for that. So I myself, I believe we're going to get ready to open up for questions and answers, but I myself have one question, and I wanted to ask you all, where is it that you all think that your career is going to take you as you further your career? And then to our students who are on, where is it that you think that the career could possibly take them? So I know that you guys might be on a different trajectory, but just for our students who are maybe considering one of your careers or something similar, what do you think this can be and can take them, in addition to where is it taking you all? Ms. Nicole, we can start with you.
Okay. As a medical assistant, you can go, I started off as a medical assistant, of course, and then went into instructor and teaching medical assistants. And I did very well with that. And then again, I decided I wanted to do the EMT. So it's pretty much wide open far as a medical assistant journey. Like I said, I did medical assistant, then EMT, and now I'm paramedic. But as an EMT and as a paramedic, with the 911, like when you have hurricanes and things of that nature, FEMA call you and ask you to come and help with the tragedies all around the world. I actually help with the Georgia World Congress Center with COVID patients, and they pay like $40, $50 an hour for that type of work because you're on the clock 24 hours. So if we get something like a pandemic, or we get hurricanes or anything that's going to be spread around the world where they need help, you are called, and then you can go to that city. To that state, Florida. We get a lot of calls from Florida, a lot of calls from California, so that itself is an incentive to be able to travel and go help with these tragedies in the world and get paid a lot of money. And they pay for your housing, your hotel room, they pay for your food, and they pay for you to get there if you need to fly there. And so those are some incentives as to be a EMT, and incentives to be a medical assistant would just be, like I said, you can become an instructor, or you can be a lead into that position. My position where I'm going now is I chose paramedics so that I can do more. I've been looking in some places in Africa that need paramedics. And so again, it's an international thing. You can get on the internet and you can just, as a paramedic or EMT, you can pave your way. And also just as a medical assistant, staying local, helping out in the community. So that's what I've been doing. I think they're both great opportunities.
Thank you so much. All right, Miss Jewel, what are your thoughts?
Well, in the dental field, there's just so many different avenues that you can go in. You can work with children. At the Children's Hospital, there's actually a dental program there. You can do ortho, which is the braces. You can do the administrative work. There's just so many different parts of dentistry that you can actually go into. I was actually, I told you guys I was an instructor. So that's another part of it. You can be a dental assistant instructor where you can teach the program. Also, I'm a CPR instructor. So you can also teach CPR. You can have your own business doing CPR. All right, you can get the dummies, you can get the mannequins, and you can do it on your own and be your own advocate for CPR. It's very important that we know how to save a life. Okay, a lot of people have, a lot of houses have swimming pools. If you have a swimming pool, if you know someone with a swimming pool, it's very important that you know CPR just in case of an emergency. Okay. In dentistry, it's just so many different avenues that you can go in. Insurance, you can work from home. Everybody's working on the computer now. You can work from home. As long as you learn the codes, how to charge insurance and how insurance works, dental insurance work, you can actually work from your home. Eventually, I think I want to open an agency where you can actually come to me for your, if you need a doctor, you need a hygienist, like an agency just for dental. They have a few of them out there now, but everybody always call me anyway because I've been in the field so long. Hey, do you know anybody? And I'm saying, wait a minute, I can get paid for doing this. So that's where I'm going next.
Awesome, thank you. All right, and then Miss Alicia, you answer that one for me.
Well, the funny thing about it is I just got started. So this is my first year as a technician. I'm still learning about all the opportunities that come with it. But there's so much that you can do. Being a lead tech, now that they have the COVID situation going on, they have a bonus where technicians can administer the vaccine and stuff like that. So it's just so many opportunities. that I'm still looking out for and I'm still researching about.
Awesome. Thank you so much. All right. So Ms. Brunson, I appreciate you ladies. Did you want to head to your question and answer session?
Yes, they're definitely asking some questions. And so we can definitely get started on that. Yeah, we're early. So these are great. I've learned so much already. I think every time I hit the computer, the PowerPoint changes. Melissa, it's not me. Okay, so yes, let's start. And our first prize is going to be for the student who asked the first question. And guess who that will be? Miss Nadia Hagans. She said she had questions. So Nadia, you get a Cash App prize of $10. Do you have Cash App? You put that. All winners should email me their information, your name, number, and if you have a Cash App, an email. So I'm going to put my email in the chat box right now, and then we'll start with Nadia's question. All right, so Nadia is our first prize winner, and her first question was, should I be a CNA first or go ahead and get the RN? So Nicole, what would you think about that?
Elderly people and doing a lot of changing and making sure they're taken care of on that aspect, whereas RN is way more in depth. And if taking care of someone like a grandparent is where you, let's say CNA, more of a challenge. You want to work side by side in the hospitals and talk to them, go to the RN program and just be ready, because it's for grueling work, not to discourage you, but to get you on the path of not thinking that that CNA and RN is anything alike. They are way like miles apart from each other. So that's where I stand with that.
Okay. Nicole, I think you kind of a little blurry sometimes, or the connection. So maybe if you take your picture off when you answer questions, that may help. But I wanted to ask Ms. Merriweather, what did you think about that? Because as Nicole said, a CNA and RN is totally different. And I believe Melissa says, or someone told me that a RN is not necessarily 4 years college these days, right. Or is it?
Right. No. So the similar to what Ms. Cross said, they are completely different, because in between a CNA, you still have an MA and then a PCP. You know, so you do have a couple places in between. The CNA, you typically can get your certification for a nursing assistant in about 6 months. I actually have seen some programs be about 8 weeks. So you can get that CNA done really, really quickly. And it actually will allow you to work like at a home health agency or something along those lines. You can work even while pursuing your nursing degree. And that's something that I oftentimes will tell my students, and Nadia is one. But I oftentimes will say that is an option that you do have, where you can do something like a CNA while you're still pursuing something different. The RN, you actually can go to, I believe they're trying to get away from regular 2 years nursing and just convert everybody to a BSN, which is the bachelor's for nursing. But you could go to a 2-year school and get your associate in nursing. The RN itself is just being registered to be a nurse. So as long as you complete, you can get an associate's in nursing and become an RN. That's only 2 years. But of course, being a BSN is the bachelor's, and that's where you're able to, you know, still do a little bit more. But when you're talking more along the administrative side, you can move up to like a MSN and kind of go on that way. But you can be an RN with just an associate's degree. Ms. Brunson, you there? I think you're on mute.
Yes, sorry. Okay, thank you for that. And let's go to her next question. Let's see. So CNA, what is the EMT schedule like?
Can you hear me?
What is that schedule?
Yes, we hear you.
Okay. The schedule is a 12-hour shift in which you, of course, you can't predict how many hours you want to get off on time, but you don't always get off on time, because if you're in the middle of an emergency, you can't stop and say, oh, well, my time's up, gotta go home. So, but a going hour is 12 hours. Sometimes you can be 13 hours. 4 hours are 12-hour shifts normally.
Okay, that's a good point. When that clock hit, and if you have an emergency right in front of you, it's not the time to go home. I would say that would be the same for Miss Jewel and Miss Alicia, right? If you're backed up and have a lot of incoming, especially with COVID going on and schedules changing, you have to be flexible. And again, that's going to make you stay out and say,
go in this class, but
what happened?
Go ahead. Somebody came on.
Oh, okay. Yeah, so these are all good points, that just because a lot of times in the medical field, it's not just an 8 to 5. Even in the dentist's office, there are emergencies, we're in the middle of COVID, so they're going to need all, workers to be flexible. And the flexible ones are the ones that people are going to keep their eye on and know that they're a team player, that they're not just going to leave because their shift is done. Okay, let's see. Miss Nadia Hagens. Okay, so is it Nieva? Nieva? Nevea. So she asked, are EMTs always on call?
No, you have a regular shift. We have what's called a California shift, in which you might work every other weekend. And what that means is Monday, you might work Monday, Tuesday, off Wednesday, Thursday, work Friday, Saturday, Sunday. And then off Monday, Tuesday, work Wednesday, Thursday, and be off Friday, Saturday, Sunday. So it's called a California shift. So no, you're not always on call.
Okay. Awesome. So Nadia has another question. What are the cons of each of these 3 careers?
The con with my career, if you want me to start.
Yes.
For EMT or medical assistant, the con is, like you said before, as a medical assistant, you may not get off on time. So if you need to pick up your kids and you still have a backlog of patients because you had an emergency come in, and you may not get lunch. I mean, it's dangerous. You don't get a lunch, or your lunch is only 15 minutes, and hopefully you can work for an office that have staggered lunches, and so it doesn't happen like that, but you will not always get off. But other than that, with medical assisting, that's only pretty much the worst thing I've ever seen. And getting, these patients are sick. You're going to get some patients that curse you out and not be very nice to you. And you need to learn how to just realize, hey, they're sick. That's why they're there. They're not going to be smiling at you all the time. As far as EMT, again, getting off late and seeing babies being abused, or having a weak stomach, because you're going to see death. You're going to see children in death. You're going to see suicides. You're going to see bad car wrecks. So if your stomach is not for that, that would be a good place to go as far as EMS.
Okay.
Miss Jewel, what do you think the cons are?
Well, let's see. Again, that whole lunch thing. Sometimes we do, sometimes we don't. That's just part. That's just part of the job. We don't have banker's hours. We do not have banker's hours. Some days you start early. Some days you get off early. It could be the patient then come in and you might get off early. One day you might work through lunch. That don't mean you're gonna get to eat. You just have to work through your lunch. You might have 10 minutes to eat. And that's fine because you understand that you have to see a patient. Someone is in pain, you have to see, we're going to see them. So that's one of the things. The pros are, well, for me, I'm off every Friday. That's my pro. So I work 4 days a week. I do work every other Saturday, but I am off every Friday. So that's what I love about my job the best. I love being off on Fridays. But yes, we do. There and the pros and cons in every job, but dentistry has been really good to me, I should say.
Miss Alicia, did you have any cons you wanted to share? I know retail.
Yeah, so I mean, retail is a beast in itself. You have to deal with a whole bunch of other stuff besides just patients. Just, I want to piggyback off of what Miss Nicole said. Everybody's not always going to be smiling. Even if you're having a great day, everybody's not going to be having a great day. And you kind of have to navigate and know how to disarm people, because sometimes they come there, there's a whole bunch of other things going on, and you kind of got to provide that light for them. You know what I'm saying? So, and I also would say, like, the lunch thing, it's not that bad, but you do have to have a team player spirit, because there's going to be times where they might offer you to take a break just because, but it's like you just have so much to do, So it's like, would you rather help the workflow and make sure that everybody gets their prescriptions on time, or do you just want to be like, okay, well, I haven't ate today, so it's, I don't know. It's always all about the people. So.
This is some good stuff. Please make sure you're on mute if you're not talking. We hear a little bit of conversation. Okay, next question. So Miss Nadia says, thank you, Miss Cross, and thank you, Miss Merriweather. Talia, I hope I got that right. Talia Jenkins, I have a question about my career I want to pursue. I want to be a healthcare provider in the Air Force. So I wanted to know if anyone knew about that field and any advice you had. So she wants to be medical, but she wants to do it through the military. Does anyone know anything about that?
I worked for I was a contract employee. I did a pharmacy at Fort McPherson before they closed it here in Atlanta. So I actually worked in the clinic, the big building that you can see going straight down, I think that was a Silver Road, or Lee Road. But anyway, anything. So the military is actually really great when it comes to helping you with your career, because they actually will cover the costs of whatever you're trying to do, and a lot of the training and everything, they actually have a lot of it provided for you. So they are really great in that aspect. When I worked in the clinic for Fort McPherson, they actually had all of the supervisors and the actual providers were in the military. So in the clinic, we actually had a doctor, we had an ophthalmologist, we had a pharmacist. The pharmacist was actually over the entire pharmacy, and she was our captain. So she was actually over it all and was the captain. So she had been in the military and was preparing to retire from the military. Our sergeant first class was like our lead tech. They were in the military. So and all this stuff is provided through the military. So she, of course, didn't have student loans or anything like that because the military covered their costs. So they're really good at providing education for their people. So anything that you want to do, you still can do it, because they actually have all these clinics and medical facilities throughout the country that are still military provided. So even if you do like the VA, all that is still managed by the military.
Yeah, I think that would be an awesome option. So you would start out with the track for military, right?
So yeah, you have to join the military, but everyone, when they join the military, they give you like an if you know what you want to do, you can so I actually have a cousin who she knew she wanted to do behavioral health. So she actually joined the Navy, and she is, you know, they either will appoint you somewhere based on if you don't know what you want to do, or you can tell them what you want to do, and then they just kind of put you somewhere while you're still in training and in school to figure, you know, to go through the process. But you have to actually be in the military for it. Now, what I will say that is that if you were to, let's say, go to school and get a degree first and then join, most of the time you actually can enter the military as an officer without having, so you won't have to start at, let's say, the bottom and be like a private and work your way up. You can actually become like a captain. You can enter as a captain if you have a degree. But I mean, it's just a few years different. I mean, most of the time, if you start as a private, you can still, you know, work your way up. It's just, you know, what you prefer. But definitely, you have to be in the military first. And then once you all go through what your plans are and what you like to do, they'll decide either to, you know, pay for you to go to school and do whatever, or they'll just assign you something.
Okay, awesome. So our next question is from Shamarian. Did I say that right? Shamarian? Okay, it says, what is your advice for pursuing these careers without any healthcare experience, such as coming straight out of high school? Can they do any of what you do or apply, I'm assuming, to become your profession? Let's say Jewel or Alicia. Oh, I'm sorry, go ahead, Alicia.
Well, it's definitely possible. As far as my career, you can start off, well, I personally started off as a clerk, and I learned more about the career, and I got promoted as a technician by registering, and then you get your certification. To register, you just have to pay the fee. And what would just help you in like interviews is just being personable and having, like, if you're in high school right now, you have like extracurricular activities, like you just have to have a well put together resume, and things like that. So for sure, you can start off straight out of high school. I have a few of my coworkers that's been in the field for 10 plus years that started straight out of high school. So it's very attainable.
Okay, so Alicia, I know when I talked with you briefly, you had started out at University of West Georgia, and you were there for a year or two, and you're like, this is not for me. So how did you get connected to where you are now, being a pharmacy tech at Publix?
Research. Like I said, I always knew I wanted to help people, and as far as college, it was a lot of pressure there. So once I went to college, and I was like, nah, this not it for me. I've just, you know, I just kept doing my research until I finally came across technician. I actually went through a program for still processing. And once it didn't take off from there, I fell into pharmacy technician. I learned more about it. And I was like, okay, I can definitely do this. So, yeah, that's how that went.
You went to Publix and asked to be a tech, or were they hiring? How did you get exactly connected?
So I just applied. I took my chances and I applied. My manager, he's always hiring or always doing interviews. So once he came across my application, he reached out to me, and at the time he said he wasn't really looking to hire anybody. He just wanted to, you know, see potentially who would be out there. And he was like, wow, you don't know anything about the pharmacy? You don't know anything about medicine? I was like, no. He was like, okay, well, I'll hire you. I'll start you off as a clerk. And it's very good to be proactive. As soon as I started as a clerk, I was just so interested in medicine. I jotted down all the medications, learned about them, learned difference between brand name, generic name. And from there, I was like, yeah, this is it's just so much about it that is so interesting, and just so much that you can do with it. So.
Okay. And then you also mentioned now there's also a test that you can take that would take you to another level. Yeah,
your certification. That would be the certification question. There's a small fee. It's about $120. And you pay that fee. They administer the test. Since COVID is going on right now, I believe you have the option of either doing it online, and they have the camera and everything, and they watch you, or I think they're slowly starting to open up in person. But there's so many different educational tools that you can use. I use Pocket Prep. There's a lot of medical things that you can learn on there too. There's over 800 questions that they can ask you on the test. It's very good to prepare you. And that's for anything. There's EMT stuff on there, dental assistant. So it's a really good app.
Okay. So right now you're preparing to take that test.
Yes,
ma'am. To be a certified pharmacy tech.
Yes.
Okay. And how much was the test?
It's about $120.
120. Okay. Okay. Thank you. Were we still answering that question? What was it? Pursuing careers right out of high school with no experience. Jewel?
Yes, you can. My advice to anyone that's interested in dentistry or becoming a dental assistant is to volunteer. Let's start there. That's easy. Okay. Find out when you go to the dentist, or your grandma, aunt, whoever goes to the dentist, ask them, hey, my niece, my nephew, I know somebody that's interested in dental. Can they come shadow? Or you can write your resume up and be presentable. Please be presentable. That's very important. Your appearance is very important when you go into these offices. And you can just ask them, hey, I'm interested in becoming a dental assistant. Can I shadow for a few hours a day? Or you can go to the dental assistant school and ask them just to see, you just want to know what the dental assistants do on a regular day. But like I said, the best way to get into it is to just volunteer.
Awesome. That's good, because I happen to go to the dental office that Jewel works at, and I asked the dentist, Dr. Samuels, I had a student who was interested in if he could shadow, and she's like, they got to come correct. This is a busy office. So you can't come and add mess or drama. You have to come dressed. You have to come respecting the patients and all of that. So that's definitely a good idea. But just again, as Ms. Jules says, you got to come dressed. You got to come professional, your resume, and ask. All you can do is ask. And especially if you have family members that go there, they see that they're already a patient, they may be more willing to give you an opportunity. So to that question, if you don't have experience now, start asking to volunteer and to shadow. Shadow means you're following that person around the office, helping, learning, and seeing what they're doing. Not, is it literally following them? But no, just kind of in their area, learning what they do and taking their cue, whatever they need you to do that you do. Okay, awesome. Anyone else want to answer on that one? Let me still keep looking. Talia says, thank you. Caitlin, let me make sure I don't skip anyone. So Nevea says, as an EMT, with the range cases that you see, how do you manage your mental health and stress levels, especially during the pandemic? Awesome question.
That is a great question. At first, with the pandemic and just the scare of COVID and how it's coming along and how you're going to be affected by it, was very scary for us. Next case with the COVID, I just pretty much prayed about it. And that's all I could do. But I had to put my best foot forward because that's what I signed up for, as far as the COVID situation. My mental health, thank God. that I have not had breakdowns, but I have friends that did have breakdowns. As a matter of fact, I had a coworker who had just had a baby, and one of her calls was a baby, and she quit that same day. And so, yeah, it's very important that you take mental health days. If you are tired, don't come to work. Call in, tell them you can't do it, because you can't give the patient good bedside manner if you're tired. So I say that I pretty much wouldn't, I would just take some days off. If it's getting too bad for you, you have to think of your health first. That's what's more important to me. And so with that go get a massage, get a pedicure, relax, work out, exercise, talk it out. Most importantly, talk about what you saw. And go to your superior and tell them, hey, this is bothering me, or this bothered me. And we do have a lot of places that you can go, on the jobs where they allow you to talk to someone about any incident that's bothering you. And that's a good thing.
Awesome. That's definitely some good advice. And a great question. So let me keep looking. Man, these students are coming with it, aren't they, Miss Merriweather? Yes, they are. Okay, so your advice, experience, mental health. So Caitlin wants to know, did we already answer this? What was the driving force that made you want to stay in your career? So I know Miss Jewel said 20 years, and I believe Miss Cross is about the same too, right? What keeps you staying?
Well, as far as me, I love patient care. I love taking care of people. I learned something new from physicians. And so the education realm of it grows. So I like that aspect of it, because things are changing every day. Medicine is changing every day. And so ever since I was a kid, I always wanted to be in the medical field. So just learning, being around different physicians, and just, my patients are just awesome. Even when they're not feeling good, they're awesome. And especially elderly. I really love the elderly, because they have a lot of knowledge, and you just want to make sure they feel good. And so they give you a lot of knowledge, because some of these patients were born in the, early 1919 and 1930s. And, things are different compared. So I try to talk to them, and, because they're lonely, because we also up to nursing homes, who don't get any visitors. And so when they see us, they light up, because now they get to get some air. They get to get out. They get people that talk to people that care about them, and they may not have any family or friends anymore. So that's what keeps me going every single day. It's just education and my patients.
Awesome. Ms. Frederick?
Again, dentistry is extremely rewarding. I love the patients. I love talking to patients. I love talking to people. I love talking, period. So I love the interaction. I love the fact that you can really make people smile. Your teeth are very important. You don't miss them until you don't have them anymore. So they're very important. The way you speak, eating your food, it's a lot of different things that we need our teeth. We definitely need our teeth. And I think I'm a very important part in that, because I help calm the patients down, and I really love what I do. I wouldn't be in this field if I didn't really love what I do. I actually love what I do. And that's important.
That is awesome. That is awesome. That's awesome. So Nadia has another comment or question. She says, I can stomach blood, urine, feces, saliva, but I'm not sure if I can stomach other substances, especially throw up. Do you naturally become used to seeing the fluid substances as you work? Good question. You just get used to it?
Let me be honest with you. I am a spit person. I mean, I can see blood, I can see intestines, I can see gunshot wounds, all of that. But when I smell vomit or if I see somebody with spit or their trach is backed up with crusty, So no, that is not anything that I get used to. And I don't know if you will too. That's just something you just have to fight through patience. Okay.
Jewel, do you see anything?
I see a lot in the oral cavity, but
No.
I've had that before. I've seen that before. It didn't really bother me. It didn't bother me that much. It wasn't exactly pleasant, but it didn't bother me that much. The patient was fine. They helped clean it up, So it's not that much of a deal. You that's something that I guess if you work with it long enough, you can get used to it. Depending on the person, I'm okay with it now.
Okay.
2 years back, maybe not, but I'm okay with it now.
Okay. What about you, Miss Merriweather? Do you experience any of that, or what do you tell your students?
No. So I actually picked a career that I'm not a fluid person. I cannot be fluid. I'm a very emotional person. And so like even my students, when they start crying, I'm crying. So I wouldn't do well. I used to want to be a paramedic, but I learned I don't do well with blood. So for me, I have a very weak stomach. Now I know in pharmacy, I have had times where I've had patients who just got a surgery or that kind of thing. So you might see like, but it's nothing where I'm a bad smell person. So if it's something that smells, I'm done. So no, I've been blessed. I haven't had to deal with any of that because I would make it.
Okay. And I think it's good to know your tolerance, what you can take and what you can't. I had a friend who said she wanted to be a doctor. So she was in college and she was a biology major, I think. And she said they went to, was it blood or she went to see an autopsy? And she's like, oh no, she changed her major right then and there. So it's definitely good that when you volunteer and you get exposed to different things, you can know if like, yes, this is something I want to do or not. I was a biology major. My goal was to become a physician, but it didn't work out because that MCAT was just really, really difficult and I just couldn't get past it. But while I was in college, I was part of the medical, association, something like Hosa in college. And they scheduled for us to go to an autopsy. So I actually went to the autopsy and they said it was a man on the stretcher. They were about to do it. And he said this man was a roofer and he was doing a job and he fell and he died. And this was 25 years ago and it's still in my head. The autopsy is still in my head, but I was okay seeing it. But again, you have to be strong for that because that's a memory, a lot of them you won't forget. But to see, like you said, death, sickness, people at their worst. Yesterday, I went to Kroger to pick up my prescription and this lady she was standing kind of to the side. So I didn't know if she was in line. So I said, are you in line? And she looked like, you see I'm in line. I said, say nothing, right? And so she gets to the pharmacy tech and he's like, what's the name? And she said part of the name, but it wasn't the name that he would have found. And she's like, I said da 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 da. He's like, well, what you said is not what I see. I'm like, oh Lord Jesus. And so he's like, then after, he had attitude with her, she had attitude, he left. So it comes to me, he's like, look, they don't pay me enough to do all this stuff. I'm a human being just like you. I ain't got time. I'm like, then I said to the pharmacist in the back, hey, Dr. Tim, because he's looking like, just put my, so this makes a lasting impression. Customer service, and again, what Ms. Cross says, people are coming sick. They're coming with Miss Alicia, people are coming sick, other issues, has nothing to do with you. So you really have to have that extra customer service to to keep things moving and keep your name and your reputation intact. So let's see. So Miss Nevaeh says thank you. Miss Nadia says thank you for your honesty, LOL. She says, Miss Miller, do you think people underestimate your job? I know you said it's busy. That's a good question.
I definitely feel like sometimes it is underestimated as far as like the workload that you have to deal with every day, like over 500 prescriptions called in. You have customers coming in, dropping off prescriptions, picking up. And it's, you know, you have a wait time for everything. And sometimes you don't get your, get to have the patient's prescriptions done in a certain time because there's insurance problems or there's maybe the system goes down. There's a lot of things that you do on a day-to-day basis. I wouldn't necessarily say that people underestimate it, but people are very demanding of you. So, you know, you have to kind of deal with that and understand like, well, everybody is here and everybody wants what they came here for. So, you know, you got to work around that and try to get better, and explain to people, be empathetic, but it's just what you have to deal with. Okay.
Ms. Merriweather, do you want to add anything? Maybe summarize what we've heard?
I think that this has been a lot of information. To piggyback on what Ms. Miller just said to answer Nadia's question, personally, I do think that career itself, pharmacy technician, is underestimated. I do think that a lot of people just think we just count pills. And there's a lot more to it. You're like, no. But for me, I do think it is underestimated. I don't think pharmacy techs get paid enough. I think you have, it's like a lot of careers in healthcare, where it is based on your experience. You need the years to really start seeing that money bump. And I know a lot of students this year, and I try to tell my kids that because a lot of them, they do think that, you know, as soon as they get out of high school, they're only making $35,000, $40,000 a year. And you're like, no, not, you know, you got to put that time in, you know, a little bit, you know, to get there. So after maybe your first 3 or 4 years, you probably start getting up there, depending on what you're doing. But I do think that is something that is underestimated for that industry itself. But I think that this has been great, Ms. Brunson. I think that you've had a lot of information that has come through in this last hour or so. So, but yeah, great.
Okay. Is Melissa on? Melissa, do you have any questions? I want to pull up the evaluation, but I want to open it up for anyone who wants to share anything else, anything that we missed. If our speakers wanted to have any encouraging words for our students, a lot of them are students at Langston. I believe we do have a parent or two or some from Fulton. If you didn't get to put who you are in the chat box, please do. Parent, community member, if you are a staff at Fulton County, please let us know.
I would like to say to the students, if you're interested in the medical field, to take any health-related classes to help you with school, any medical terminology that you can get, because I know that they sometimes offer health classes. I would definitely get into one of those classes so you can be more familiar when you do enroll as a medical assistant or as an EMT. That definitely will help you out tremendously to learn the body before you get there.
That's good. Anyone else?
Again, I would just like to say, if you can, I don't know if the guys, since the COVID, if they haven't the career day at the school, but if they do, I would definitely like to come by if you guys are still doing that. I don't know, later on, maybe next year, or if you guys need me to come before then, that's something that I would actually like to do. being that I used to teach, I do like to talk a lot and teach as much as I can. So if anyone, wants to learn more about dentistry, and you can let Miss Brownston know and she can get in contact with me.
All right. All right. Anyone else? Ms. Cross, Alicia, parents, teachers, students?
Well, first and foremost, I want to thank everybody. I actually learned so much being on here from, everyone else's career, and y'all have so many years to back you up, and hopefully one day when I get there, I can, say the same and still enjoy my career. As far as the students, like Ms. Nicole said earlier, just, I made the same mistake of like taking a year off because I did not know what I wanted to do. But if I, had this opportunity to be on, something like this and learn so much from these guys, like I would have done this, and I would have been in a career for 5 years now and, learned so much more. So I would say like, y'all are definitely in the right place. It's a great opportunity to be here and learn so much from these ladies. Take it and put forth everything that they taught you for real and start planning on your future.
Awesome, awesome. I think we have another one. Yes, Nadia. Nadia, do you want to go ahead and ask your question? Nadia? Nadia says, I have one more question if that's okay. So I'm saying, yes, Nadia, please ask. Unmute yourself and ask.
She asked it in the chat.
Oh, as far as the racism, how do you deal with it? Like some people don't want us taking care of them. Ooh, yes. Yes, yes, yes. Who wants to start?
I'm sorry, my it was going out. What was the question?
The question says, as far as racism, how do you deal with it? Like some people don't want us taking care of them.
Yeah. You're actually right. What I found in the field is when we're called on scene, this is Nicole, by the way, with EMT, when we're called on scene and we get a patient that says, I don't want that blankety blank touching me, my firefighters and my police officers in the bud, they say, look, if you don't want them touching you, then you don't want me touching you. And it's the support of them that help you through a situation like that, because you definitely will be faced with that. And so again, I'm glad for the other public officials that's out there with us to back us up on that.
Oh, that's good. That's good. Anyone else dealt with that?
Well, we don't really have a whole lot of that, to be honest. If they're coming to us and they're in pain, they need help. So
yes.
That's basically it, So we really don't, I can honestly say I didn't encounter any of that. Not yet anyway.
Yes. What about you, Alicia?
I wouldn't necessarily say I've dealt with racism. I've just dealt with very nasty people of all different shades. So it is very important to have the support of like the higher ups, like the pharmacists, the managers and stuff like that, because you can't really do anything on your own, So if you have that support system there, it's really good. And if you don't, it's kind of like you gotta work with it, gotta work around it.
Yes. All right. Anybody else? So I did include the evaluation link. If you guys, everyone on here, if you could please click on the link and fill out the short evaluation and tell us what you thought about today. And let's see, we do have some more prizes to give. So we have it's Nadia, right? Miss Nadia Hagan gets she asked the first question. And let's see, what's our other prize? I'm going to have to log on later to find out who was the first one to log in. But right now it's looking like it's, is it Burnett? Doncor. I'm going to confirm that, but that may be the first student who logged on. Now, if I could get anyone on here, anyone on here who can tell me 3 things that they've learned today. You can unmute yourself and tell us 3 things you learned today. You're going to get a $15 DoorDash gift certificate. Tell me, either you unmute yourself or text me in the chat saying I want to give it a whirl. 3 things you've learned today from our seminar. Oh, it's already 3:25. Okay, do we have anyone? I know we do. I know you can tell me 3 things. Anyone? No one can share 3 things that they've learned? I'm gonna start calling out. Candy, Nevaeh, Nadia, you asked lots of great questions.
Nadia said she'll try. Nadia said she'll try, and so did Nevaeh. They put it in the chat.
Perfect. Okay, Nadia, let's start. Unmute yourself. Go ahead, Nadia. What happened?
She may not be able to. She said, how do
I unmute? Let's see if I can unmute you. Can I? It seems like you are. Okay, Nadia, it looks like you're not on mute. You can talk. Now she's back on. Go ahead, Nadia.
Maybe see if Nevaeh thinks she
Yeah. Nevaeh, you can unmute yourself.
Can you hear me?
Yes.
Okay. Hey y'all.
Hey.
Okay, 3 things that I learned was that EMTs have California's schedules and that pharmacy techs do more than just count pills. I had that misconception, but they deal with like the what's it called, insurance people, and that dentists, like the dentistry is different, like types, like the orthodontist, for example, with braces and stuff. And yeah.
Okay. Awesome. Awesome. Good job. So remind me again the California schedule. What was that?
I think that was like Monday, Tuesday, Wednesday, like 1 day off, and then Thursday, Friday, or some 3 days off, 1 day on.
Okay, like 12-hour shifts. Miss Nicole, was that right?
No, a California shift is 12 hours and it's like you're off every other weekend. So you work Monday, Tuesday, off Wednesday, Thursday, work Friday, Saturday, Sunday, off Monday, Tuesday. So it just rotates around where you'll be working 2 weekends a month.
Yes.
Okay. All right. All right. You got that, Nevaeh? Good job. Good job. We've all learned something. Okay, Nadia, you ready?
You can hear me?
Yes.
Okay, good. 3 things I learned is that some of us face racism and some of us don't. I guess it's just on personal experience. Another thing I learned is that dental assistants of Miss Frederick, she said that people hug her. I never thought about it until now, until she said something, how you know, important our smiles are. I mean, I get compliments on mine, but I never thought about it until she said it, how, you know, important it is for us to eat and talk and stuff like that. And then my last thing was how EMTs, they face fines if they have their sirens and lights on. I guess it's very tempting to do it because if you have some place you want to go, then you want to go, but I never knew you could get fined for it.
Awesome. Very good. So Nadia, you're going to get a $15 e-DoorDash, and so is Nevaeh. Good job, ladies. Are you both students at Langston with Miss Merriweather?
Yes, ma'am. I actually take one of her classes.
Okay. Isn't Miss Merriweather like the best?
Yes, her class is actually my favorite.
Oh, wonderful, wonderful, wonderful. So I want to ask, are you both in Hosa?
Yes, ma'am.
Okay, good job. So what I want you to do is I'm going to put my email in there again, Bernice at Zena's house. So you email me your information. So I'll need your name, number, and email, and I will, I don't need your phone number, just your name and email, and I will send you the DoorDash gift card. And Nadia, you get the $10 Cash App. So if you have a Cash App, let me know, or if you don't, I'll find some other way to get you that prize. Okay, and so the last prize will be the first student who logged on, and I will confirm that after our call. So I did submit the link for the evaluation. So hopefully you'll take a few minutes to complete that. And I'm sorry, all of a sudden we can't move forward with our slideshow, but Miss Merriweather gave me a number of institutes in the Atlanta area. If you're interested in the dental assistant program, EMT, pharmacy, all of that are provided at different institutions. So you can read up on them and look them up, check them out, ask some questions, ask Miss Merriweather those questions. And if you're really serious about pursuing it, you have Miss Merriweather at your disposal. You have us now that we would love to help you in any way we can. So it is 3:32. Thank you all for taking time out on this Sunday afternoon to learn more about these awesome careers. Thank you, Ms. Merriweather, for moderating. Thank you, Melissa, for preparing the slides. I'm sorry I didn't get to have them all, but I can definitely send you the slides once we're done. So Zena's House is a nonprofit organization in South Atlanta. We provide life skill workshops, college trips, all kinds of information, resources, and opportunities for our young people. We are partnering with a local organization that's doing a college expo during spring break in Fairburn. It's April 7th through the 9th, and it will be outside in the church parking lot, pending COVID cases still going down, weather good. There'll be lots of different colleges, not saying that, you know, you have to go to college or anything, but that expo will be happening if you're still interested in at least doing some research or letting other friends, family know about it. But they are also offering seniors, class of 2021, a community award Recognition, CAR for short, CAR. And they are inviting all students, all seniors. If you attend the 3-day expo, pay the registration fee of $30, attend the expo, and submit a letter of acceptance from any, if you're applying to an institute, a college, if you've already been accepted into the military, you email that to the email on the flyer, and they will award you $125. So I wanted to extend that all to you. I will give the information to Miss Merriweather, and if you are interested, please email me at bernice@zenashouse.org, and I'll send you the flyer. So again, you attend the expo, register $30, submit a letter of acceptance, either military, your career institute, training, or college, and you'll receive $125. Again, to acknowledge you, award you, and just say thank you. We know it's a difficult time for our seniors this year, and we want to just do a small thing to encourage you. So again, thank you for your time. Stay tuned for other workshops, and have a good evening.
And thank you, Ms. Bernice and Ms. Merriweather and Melissa, for allowing me the opportunity to speak with the students. And thank you to the students for the questions that you asked.
Yes, great job on the questions. Thank you, wonderful speakers, Ms. Cross, Ms. Frederick, Ms. Miller. We really appreciate you. I asked and you just said yes. So I really appreciate you again and your time, and we wish you all the best. And we'll be reaching out in case our students have some more questions, or if you know of any opportunities for them.
Yeah,
definitely. Thank y'all.
It was
great talking to all.
Bye-bye.
Bye-bye. Thank you.
Langston.
Bye, Ms. Merriweather. Thank you.
Bye-bye.
Bye-bye.